Hello, my name is Dr. Erica Soto. I am a licensed marriage and family therapist. I have a doctorate degree in clinical psychology and a pupil personnel servicing credential in school counseling. I also teach here on campus at CSUSB. I wanted to talk to you today about the journey of becoming a licensed therapist, specifically if you are interested in providing therapy to children. Now, there are many different roads you could take that kind of all land you in a similar place if your desire is to work with children in their families. So we will go over the journey, the requirements, and also look at what child therapy typically consists of. In order to become a licensed therapist, you must go through a graduate program. So when I say licensed therapist, it's a process to become licensed. We'll talk a little bit more about that in a later slide. But there are different types of programs that you can go through that can land you in a similar but maybe slightly different place. I personally went through the licensed or the marriage and family therapist program. So I am an LMFT. Cal State San Bernardino has an excellent MFT clinical counseling program that I did. And basically what it is it's a 2-year program that you take certain classes and get a certain amount of hours practicing with clients and so forth, and that meets the state requirements to become a therapist on their way to licensure. Now, the term licensed marriage and family therapist is a little bit misleading. I personally remember when I was doing my research on graduate programs, I was a little bit thrown off by this term. I thought, well, I don't want to work with marriage. I don't want to be a couples counselor. That's not necessarily what you have to do. You are free to work with a variety of populations, a variety of age groups. You can work with children, families, adults, couples. The license type actually used to be marriage, family, and child therapist, but they changed the language a bit. And marriage and family therapists are the license type is pretty specific to the state of California. You can go for an LPCC, licensed professional clinical counselor. This is similar to an MFT, and it's a lot more popular across, statewide. So you hear licensed professional clinical counselor or licensed professional counselor. Every state's a little bit different, but that's definitely the more popular one. There's a ton of overlap with these two license types. So with an LPCC, you can also work with a variety of different populations, age groups, children, families. But really, the professional clinical counseling emerged from school and career counseling. So a lot of counselors who work in schools for social, emotional, mental health counselors are an LPC. And even though they have a focus on mental health, they might kind of view treatment in a different way than MFTs. MFTs kind of focus on relational, kind of views challenges as relational, whereas LPCs typically are more likely to view it from an individual or developmental lens. So that kind of goes into a different topic in that every therapist, every license type kind of has a different style, but they both allow you to work with children. You may also go for a doctorate in psychology. Basically, this allows you to become a licensed psychologist, which is different than a licensed marriage and family therapist or a licensed professional clinical counselor. Really, the emphasis is you can certainly see clients in therapy, but there's also maybe some psychological testing that takes place. Then there's also the Doctor of Psychology, which is a PsyD, and this also leads you to become eligible to become a licensed psychologist. The difference between the PhD, and the PsyD, the PhD typically focuses a lot more kind of on research in the program, whereas the PsyD focuses more on clinical elements. Okay, so this is just a brief overview. So when it becomes time for you to look for graduate programs, it's very important that you do the research. You must do the research. What are your goals? And you don't even know, you don't need to know exactly what you want to work with. I thought that I wanted to work with adults, and I didn't think I wanted to work with children, and this is how it worked out. So you might have an idea and change along the way, but you do want something that gives you kind of some flexibility in what you work. If you know that you want to become a licensed psychologist because you want to do psychological testing, then you definitely have to go for the doctorate. But if you are more interested in therapy, clinical counseling, and there's no way I want to do psychological testing or research, you're fine with the MFT or LPC. There's also the social work route. Many social workers go on to develop to get a license in clinical social work. Not all, but that also allows them to do therapy with any population. And also you see a lot of school-based social workers who also work with, kids and teens and young adults. So there's that option too. So again, some people will say, oh, I chose the social work route because I didn't know, social work allows me to eventually become a licensed therapist or not, or I could work in different settings. So very, very important to do the research. Let's look at a typical graduate program, so the requirements. All of these, even if you are pursuing a doctorate, will look similar. The length will change. Doctorate degrees are obviously longer, especially if you are going for straight out of your bachelor's. Some people do get into programs straight out of their bachelor's. Many, get a master's first. But they all have different requirements, but there are some components that will be the same. So of course, in your graduate program, you will be required to take a certain amount of course units, so just classes. It's not bad because you are focusing on exactly what you want to be doing. Graduate programs tend to be smaller than undergraduate programs, so there's also that personal touch. You really get to know your cohort, your professors. So it's pretty great. It also requires a successful completion of typically one of three things. So you might write a thesis, the program might require some type of final project, maybe with research, or a comprehensive examination. So like a big test, basically. Typically this is what it doesn't start at the end necessarily, because you're either spending a lot of time writing it, preparing it, or studying for it, but you typically complete it towards the end of your program. And then the final main piece is there is some practicum experience. So the program will require you to have obtained a certain number of either internship hours, traineeship hours, so basically where you are working in the field. Of course, you are under supervision, and you will attend supervision, but part of your time in the program is seeing clients and maybe interning at an agency. So that's really where you get that practical feel. That's where you get to start practicing applying what you're learning in your textbooks and in your classes to the actual field. So once you do all your coursework, complete, the exam or the final project, the thesis, and complete your internship, you've graduated. You are a graduate, and that's really exciting. The learning does not stop there, though. So once you are a postgraduate therapist, that does not mean that you are a licensed therapist yet. you're closer, but you're not quite there. So you are either an associate, so the MFTs and LPCs are called like an associate marriage and family therapist, because what that means is that you are practicing under supervision, meaning that you are practicing under a supervisor's license because you're still in training. And the board, the state, requires you to obtain a certain amount of supervised hours in order to be able to sit for a licensing exam. So for MFT in the state of California, you need 3,000 supervised hours. Now, that does not mean that it's all direct client hours. Most of them are. So most of them are time that you sat in a room with a client or in your work setting doing some type of direct therapy, direct intervention. But it does allow some room for any additional trainings that you get or documentation time, because that's a big part of it too. So you are free to choose a desired population that you're interested in working with. Some people end up staying at their internship sites because they really love it. Other people, it's a lesson learned, more information that, oh, hey, this is not the population for me. So you can decide, I want to find a job that only works with children, okay? And you could also choose the setting. So, okay, I want to work with children, but do I want to work in a school? Do I want to work in private practice? Do I want to work in crisis, inpatient, and what have you? So whatever you are most interested in and feel like is your niche, you are free to obtain your hours. But the caveat is that the agency or the place has to be in agreement to hire associates and provide supervision, which most are. So like I said, you don't get to advertise yourself as a licensed therapist until you have met all your hours and passed your licensing exam, okay? So supervision, and you start this in your graduate program, is typically there's a one-on-one component, and then there's also a group component. Some supervisors, schools might vary in this, but you typically have some form of group supervision where it's you and other learners, in group talking about cases, as well as individual supervision. So really, supervision is there to provide guidance, offer support, explore how the process is going. You might, in my graduate program, we had to tape our sessions with our clients and show them in supervision. Very anxiety provoking, absolutely. But such a great learning tool, and everyone's in it together. So, oftentimes you don't realize all of your nonverbal behavior until you're watching yourself. So, supervision's great because that's really, really, really where a lot of the growth takes place. So, as you're getting near reaching the state's requirement of hours that you are accumulating under supervision, so let's use MFTs for an example. So I'm getting close to my 3,000 hours. I want to start thinking about the licensing test. The licensing test is the big thing that a lot of therapists talk about. It takes a lot of study times. Typically it's about a 4-hour test. Now I will say that they just changed the MFT requirement to have a law and ethics exam before your licensing exam. At some point in your journey as an associate, but that is a little bit separate from this. So I'm talking about kind of the end game here. So as you are undergoing supervision, as you are practicing, typically people are able to gain their 3,000 hours within 2 to 3 years. You can count most of your internship hours in your graduate program as well. You are documenting all of this. So the board has forms that you print out, and that you every week you put how many hours you seeing clients, documented trainings, whatever. Each week your supervisor signs off on them. Eventually, when you're done with your hours, there's all the paperwork that you have to submit to the board. and the board goes through your paperwork to ensure that, yes, you have in fact completed your 3,000 hours. They've been all supervised, and then they give you approval that, hey, you are eligible to sit for licensing. You need to make time to study. It's a big test. It focuses on diagnosis, theory, law and ethics, and there's a ton of study programs out there. You will likely make friends as you are practicing as a therapist. So some people do study groups, and there's a ton of support out there to make sure you're prepared for the test. So that is the big goal, is to pass the licensing test. Okay, so you get your hours, you get approval to sit for licensure, you take your test, and you pass. Woohoo! First things first, you celebrate, because anyone going through this process knows how rigorous it is. It's a big deal. So you typically get results right away, and you walk out of that room, and you're either really excited or really disappointed. If you're really disappointed, that's okay. You have another opportunity. But once you pass the test, whether it's the first time, the second time, the third time, you have to wait for the board to post your license online. So you can't technically stop and advertise yourself as a licensed supervisor or a licensed therapist the very next day. You have to wait for them to send you your license number, and then it's official. So once you're a licensed supervisor, I keep saying that, once you're a licensed therapist, you no longer are required to have supervision on a regular basis. So there's no more requirements to log your hours, to get, those weekly signatures, no requirement to document. Of course, you will document all of your sessions, but there's no more supervision requirements. However, just because we're licensed doesn't mean that the learning stops. We always have room for growth. So what many licensed therapists do, it's optional, but highly, highly, highly encouraged, is to continue to consult with other therapists. So there's license groups that, meet at some agencies, have consultation groups, because there's always going to be, no matter how seasoned you are as a therapist, there's always going to be cases that stump you. There's always going to be challenges. I've, worked with trauma in children a ton of times, but for some reason this child just is not responding to my intervention. Can we staff this together? So it's it's a huge weight taken off your back, because you don't have to allow for 3 hours of supervision each week, but it's also important to kind of identify a community who could help you continue to grow as a therapist. So kind of piggybacking off of what I just said, there's no such thing as a finished therapist. So therapists can have been a therapist for 40 years and still not know everything. That's the really exciting part about this field. We're learning, we're growing. There's so much research being done on how we treat people who are struggling, kids with trauma. Now there's been so much research done on what's helpful and what's not helpful for treating kids with trauma. So one other thing that you need to do as a licensed therapist is you'll have a certain amount of continuing education to fulfill each license renewal period. So MFTs need to renew their license every 2 years. Within those 2 years, we have to take a certain number of continuing education, specific topics. So there's you always are required to stay up to date on law and ethics. There's a required suicide training, and then you are free to pick different topics. So you will stay up to date that way, and then most therapists will choose to specialize in something. So yes, I'm licensed, but I am going to become a certified play therapist, or I am going to become a certified eating disorder therapist. So there are certifications that you could also obtain, because we can't specialize in everything, right? So many people, so say, for me, I love working with children and families. So I spend my time learning about different approaches in doing so. Okay. So because this is a child development course, I just want to kind of introduce you to what a child therapist does. I know I've sprinkled in a little bit here and there about kind of what that looks like, but let's really kind of highlight the components. So when you are working with a child, it's almost always necessary to involve the caretaker or the parent. First off, no child is going to sign up for therapy, right? They get put there for some reason, and usually it's not a good reason. But kids, as we know, are learning the most from observation, from what's being modeled to them. All behavior is a form of communication. So whether it's because of a traumatic experience that was outside of the household or something happening in the household, we need to really figure out what's going on. And typically, you are going to need to spend a decent amount of time with the parent or caretaker if appropriate. So it would not be appropriate to spend time or include the parent if they are abusive. That's a different thing. Or you can if they're open to learning, but if it will do more harm, of course not. But for the most part, you kind of view the child and the parent as one system. It doesn't mean that you don't spend time alone with the child in therapy, but it's really important to kind of share with the parents or the caretakers what's going on in therapy, because that way, if you're teaching them certain skills, they're only with you maybe an hour per week, whereas the parent's with them the rest of the time. So it's important to offer them some insight on what's going on, what we're learning about in sessions, so they could help generalize the skills. Easier said than done. Sometimes every parent is in a different place as far as how involved they want to be, or how much education they're in need of. But you take it client by client. So again, I remember feeling intimidated when I started working with children, because there's no getting around it. There has to be some level of involvement with parents in order to see efficacy. A child might present to therapy for a number of reasons. They might have had trauma. They had a traumatic experience. They're grieving someone. They lost someone. They're showing symptoms of anxiety, depression. There's adjustment struggles. So maybe they just moved and they're having a really hard time, going to school. Of course, there's social emotional learning feelings and social skills, how to interact with others. Kids their symptoms are gonna be, they're gonna come out in behaviors, right? So it's not uncommon for a parent to present the child, in your first session and say they're doing this, and that. No child wakes up and says they want to be bad or, make their caretaker or parent mad. That's just the tip of the iceberg. Something else is going on underneath. So being a therapist, you're a little bit of a detective, because you are gathering history, you are doing analyses, looking at exactly when this behavior occurred, what happened before, what happened after, really figuring out what's at the crux of that behavior. And then, like I said earlier, there's a variety of settings you could work with children and families. You could be school-based. So I work in schools, but I work in virtual schools. So typically I do have access to the parents. Some settings you won't have much access, like school. Parents don't come to to school with their kid, but of course you can invite them to your office, have phone calls and things like that. There's private practice. You can work in private practice and advertise yourself as only accepting child clients. There's outpatient clinics, inpatient clinics. So Maybe a teen is struggling with depression and they are at risk of harming themselves. They might be in an inpatient program, so they're being monitored, and you might, be the therapist on site. And then there's something called wraparound services. That's another example of some therapists provide wraparound services, which basically you go into the home and kind of offer support in the home. You could really obviously see what's going on. And also there's what's a lot more popular now is teletherapy. So believe it or not, kids do really well with teletherapy. Not all kids. Some kids do need that face-to-face interaction. But there are a lot of perks. There's pros and cons to everything. Teletherapy is great because typically you could observe them in their natural environment. And if you're working with kids, there should be a parent or caretaker around, so you could also involve them to, a level that's appropriate. I just wanted to list some examples of programs that you can kind of start to look at if you're interested in going this route. No matter where you're at in your undergraduate program, it's never too early to start. Here are just a few examples of different programs Cal State San Bernardino offers. I'm biased. I love CSUSB, but that does not mean that there aren't other excellent programs as well. So I know Cal Baptist University has a great one, Azusa Pacific. There's a lot out there. So these are just to kind of get your feet wet. You can get an idea of what's required. A lot of times there are things that are required that will take time, meaning like they want, it looks good to have some type of experience volunteering, or you'll need letters of recommendation. So it's important to start building relationships with your professors now, so they could write you a strong letter. So it's just good to have an idea of what is required for the application, because it's a big job in of itself. So be prepared and start exploring early if this is the route you want to go. And to finish this off, this is a small segment of play therapy examples. Typically with kids, you always want to involve some level of play depending on their age. But even teenagers like this too. There's some level of like art, drawing, board games, and it could be a lot of fun, and you get a lot of your information based on their play. So a lot of child therapists will specialize in play therapy or incorporate some. You could become a certified play therapist, but you don't have to become certified to implement toys and things. But this is really the way children communicate to us. We look for themes. We look for we kind of interpret and explore their behaviors, how they react to certain things. Kids really communicate to us through play. So this is just a small example of what some type of session might look like. All therapists have their own approach. Keep that in mind. But I hope you enjoy it.